Hey everybody, this is Todd and Tori from Evolve Health and Wellness. We just want to talk briefly about some of the pros of hormone replacement therapy, especially in women, men as well, especially as you age in life, get closer to menopause, or some of the men get a little bit older. So Tori, why don't you kind of start out and talk to us about some of the benefits of hormone replacement therapy with females, especially as they get closer to menopause, and why hormone replacement therapy is so much better than maybe not hormone replacement therapy.
Okay, Todd, that's a great question. So right now I've had a plethora of women come in and say, I don't feel good. I'm not sleeping at night. The anxiety is out of control. I'm in love with my partner and I just have no interest in my partner. I've gone to my family physician. They test all my hormones and all my hormones are completely normal. Tori, I got all the paperwork right here. All the hormones are normal. And they come to me because they want to know what else is going on. And what's really sad in the controversy of just hormones alone is the Women's Health Initiative put a huge scare and halt on women's hormones. So essentially you have a group of women, more than 20 million, that don't have the benefits of hormone therapy. And when I talk about benefits of hormone therapy, I'm talking brain health, heart health, cardiac health is amazing. Osteoporosis, prevention of Alzheimer's, dementia, the risk of, realistically, if a woman falls and has a fracture in her mid-60s, statistically, she has a high rate of mortality within the first year.
You know, and it's unfortunate that the World Women's Health Initiative did this to women. And my understanding is, there's been multiple studies since then, and I've kind of disproven most everything that came out of the Women's Health Initiative. More so with the fact that they were using non-bioidentical hormones, and we only use bioidentical hormones here, but the benefits, it truly sounds profound.
Especially when started early. You really think of perimenopause starts about 10 years before menopause alone. And I don't know about you, Todd, but just looking at women's hormones now, especially the testosterone levels in women or young women are quite low. Don't know if it's environmental, but testosterone is a very important hormone for women and it's often overlooked. Not just a libido itself, but energy, brain fog. And if you actually graph out testosterone for women in our younger age, in fact, we make more testosterone than estrogen per picogram.
Well, it's a good segue also into the men, because you're talking about women at an earlier age needing hormones and especially testosterone. And we're starting to see that in men. I've had men come in in their late 20s, early 30s with testosterone levels lower than some of the women that we're actually treating with testosterone. It's quite profound. A lot of times we see these lower hormone levels in high stress environments. We have women who are police officers, men who are firefighters, these stresses, and then you start adding endocrine disrupting chemicals, preservatives, processed foods. All of these things tend to lower hormone levels in general earlier in life. So it's better to start early to overcome these chemicals and these processes and these stressors that are interfering not only with the production of hormone, but also how hormones interact at the cellular level.
You know, I actually had 2 women come in yesterday, for example, and I'm going through their med list, and they're quite young. They're in their early 40s. And when I'm going through their med list, they're on anti-anxiety, trazodone for sleep, metoprolol for palpitations. And as I kind of go through everything, you have to sit back and reflect. You have to treat the cause, and you have to understand exactly what's happening in the body. Granted, this isn't true all the time, but however, I feel like more than 50% of the women that I'm seeing in right now are on medications or polypharmacy just to combat symptoms of perimenopause and menopause.
And what's unfortunate is most people don't understand when they go to their primary care doctor, endocrinologist, maybe a psychiatric person. They put them on an SSRI, they put them on some type of medical condition and say, hey, you've got depression. Well, what is depression? It's really, really misunderstood, and they put them on an SSRI. Well, first of all, what's the major side effect of all antidepressants? It's weight gain. So you have a woman come in, like you talked about, typically overweight, try to do everything they can. They don't feel good. They're on an SSRI, and it's this vicious cycle. And you kind of put them on hormones, and you can transition them off typically over time, and they absolutely feel amazing. And that's what I like to hear that we could do for women and as well as men who need hormones just as much as women. Bone health, brain health, heart, libido, sarcopenia, which is muscle wasting. As you age, you just start to lose muscle, even if you're in the gym working out. So, it's unfortunate that both men and women have this misconception about hormones. And I'm glad you allayed some of the fears, which is awesome. So I'm glad to hear that, you're taking care of it. We're doing this together. And I hope if anybody has any questions or concerns or comments, you can always reach out to us. Our information is going to be below this video. We're in the Ameritrail Center, just east of Narcoossee Road. Come out and do a consultation. See if this is right for you. Hormones may not be right for you. We tend to think they're right for everybody, honestly. You could be in the gym perfectly working out. You could eat every bit of food. You can be the healthiest you can, but God just turns your hormones off at a certain point, and there's not much you can do to replace those, and all of the negative sequelae come from that. And we just want to see people happy and healthy. So reach out to us. We're glad to take care of you. Again, I'm Todd. This is Tori from Evolve Health and Wellness. Thanks for stopping in.